Eye infections, causes, types, symptoms, diagnosis, and treatment. Eye infections occur when harmful microorganisms such as bacteria, viruses, fungi, or parasites invade different parts of the eye, including the conjunctiva, cornea, or eyelids. They can cause irritation, redness, swelling, pain, and even vision problems if not treated properly. 1. Causes of eye infections. Eye infections can be caused by various microorganisms, including bacteria, Staphylococcus aureus, Streptococcus pneumoniae, Chlamydia trachomatis, Neisseria gonorrhoeae. Viruses, adenovirus, common cold virus, herpes simplex virus, HSV, varicella zoster virus, VZV. Fungi, Candida, Fusarium, Aspergillus species, often due to contaminated contact lenses or injury. Parasites, Acanthamoeba, common in contaminated water, leading to severe corneal infections. Common risk factors for eye infections include heavy checkmark poor hygiene, touching the eyes with dirty hands. Heavy checkmark contaminated contact lenses. Heavy checkmark exposure to infected individuals. Heavy checkmark weakened immune system. Heavy checkmark injury or trauma to the eye. Heavy checkmark allergies. 2 types of eye infections. A. Conjunctivitis, pink eye. Heavy checkmark cause, viruses, bacteria, allergens, irritants. Heavy checkmark symptoms, redness, itching, watery discharge, swelling of the eyelids. Heavy checkmark treatment. Viral, usually self-limiting, artificial tears, cool compresses. Bacterial, antibiotic eye drops, e.g., erythromycin, ciprofloxacin. Allergic, antihistamines, avoiding allergens. B. Keratitis, corneal infection. Heavy checkmark cause, bacteria, viruses, HSV, VZV, fungi, parasites. Heavy checkmark symptoms, eye pain, blurred vision, sensitivity to light, corneal ulcers. Heavy checkmark treatment. Bacterial, antibiotic eye drops. Viral, antiviral medications, e.g., acyclovir. Fungal, antifungal eye drops, e.g., netomycin. C. Blepharitis, eyelid inflammation. Heavy checkmark cause, bacterial infection, skin conditions, seborrheic dermatitis, rosacea. Heavy checkmark symptoms, red swollen eyelids, crusting, itching, burning sensation. Heavy checkmark treatment. Warm compresses, eyelid hygiene. Antibiotic ointments, VIF bacterial. Artificial tears for dry eyes. D. Uveitis, the inflammation of the uvea. Heavy checkmark cause, autoimmune disorders, e.g., rheumatoid arthritis, infections, toxoplasmosis, syphilis, tuberculosis. Heavy checkmark symptoms, eye redness, pain, blurry vision, floaters. Heavy checkmark treatment. Corticosteroid eye drops. Immunosuppressive therapy for autoimmune causes. Antibiotics or antivirals for infectious causes. E. Endophthalmitis, severe eye infection. Heavy checkmark cause, bacterial or fungal infection, often after surgery, trauma, or injection. Heavy checkmark symptoms, severe eye pain, decreased vision, pus in the eye. Heavy checkmark treatment. Intravitreal antibiotics or antifungal agents. Surgical intervention if necessary. F. Acanthamoeba keratitis, parasitic infection. Heavy checkmark cause, acanthamoeba, common in contaminated water and contact lens wearers. Heavy checkmark symptoms, severe pain, blurred vision, corneal ulcers. Heavy checkmark treatment. Warm compresses, eyelid hygiene. Antibiotic ointments, VIF bacterial. Artificial tears for dry eyes. D. Uveitis, the inflammation of the uvea. Heavy checkmark cause, autoimmune disorders, e.g., rheumatoid arthritis, infections, toxoplasmosis, syphilis, tuberculosis. Heavy checkmark symptoms, eye redness, pain, blurry vision, floaters. Heavy checkmark treatment. Corticosteroid eye drops. Immunosuppressive therapy for autoimmune causes. Antibiotics or antivirals for infectious causes. E. Endophthalmitis, severe eye infection. Heavy checkmark cause, bacterial or fungal infection, often after surgery, trauma, or injection. Heavy checkmark symptoms, severe eye pain, decreased vision, pus in the eye. Heavy checkmark treatment. Intravitreal antibiotics or antifungal agents. Surgical intervention if necessary. F. Acanthamoeba keratitis, parasitic infection. Heavy checkmark cause acanthamoeba, common in contaminated water and contact lens wearers. Heavy checkmark symptoms, severe pain, blurred vision, corneal ulcers. Heavy checkmark treatment. Antiseptic eye drops, e.g., polyhexamethylene biguanide. Corneal transplant in severe cases. 3. Symptoms of eye infections. Symptoms vary depending on the type of infection but may include heavy checkmark redness in the eyes or eyelids. Heavy checkmark swelling of the eyelids or conjunctiva. Heavy checkmark itching or irritation. Heavy checkmark pain or discomfort. Heavy checkmark discharge, watery, mucus, or pus-like. Heavy checkmark blood vision. Heavy checkmark light sensitivity, photophobia. Heavy checkmark excessive tearing. 4. Diagnosis of eye infections. An eye doctor, ophthalmologist or optometrist diagnoses eye infections based on heavy checkmark medical history and symptoms. Heavy checkmark physical examination, checking redness, swelling, and discharge. Heavy checkmark slit lamp examination to inspect cornea and eye structures. Heavy checkmark fluorescence staining test to check for corneal ulcers or damage. Heavy checkmark microbial culture and PCR tests to identify bacteria, viruses, or fungi. 5. Treatment of eye infections. 8. Home remedies and general care. Heavy checkmark avoid touching/rubbing your eyes. Heavy checkmark use artificial tears for soothing irritation. Heavy checkmark apply cold or warm compresses to reduce swelling and discomfort. Heavy checkmark maintain eyelid hygiene, especially for blepharitis. Heavy checkmark wash hands frequently to prevent spreading infection. Heavy checkmark avoid wearing contact lenses until the infection clears. B. Medications. Heavy checkmark antibiotics, ciprofloxacin, erythromycin, tobramycin eye drops for bacterial infections. Heavy checkmark antivirals, acyclovir, ganciclovir for viral infections like herpes. Heavy checkmark antifungals, enetomycin, amphotericin B for fungal infections. Heavy checkmark steroid eye drops used for inflammation with caution. Heavy checkmark antihistamines for allergic conjunctivitis v.g. olapatidine. C. Surgical interventions for severe cases. Heavy checkmark corneal transplant for severe keratitis or scarring. Heavy checkmark intravitreal antibiotic injections for endophthalmitis. Heavy checkmark eyelid surgery for chronic infections like blepharitis. 6th. Prevention of eye infections. Heavy checkmark maintain proper hand hygiene before touching eyes. Heavy checkmark clean and replace contact lenses properly. Heavy checkmark avoid sharing towels, eye makeup, or contact lenses. Heavy checkmark use protective eyewear in dusty or polluted environments. Heavy checkmark manage underlying health conditions like diabetes or allergies. Heavy checkmark get regular eye checkups to detect early signs of infections. 7. When to see a doctor. Seek medical attention if you experience police car light severe eye pain or vision changes. Police car light persistent redness or swelling. Police car light thick or greenish discharge. Police car light sensitivity to light. Police car light symptoms lasting more than 2 to 3 days. Conclusion. Eye infections can range from mild to severe, with some leading to vision loss if left untreated. Understanding the causes, symptoms, and treatments can help manage infections effectively. Proper hygiene, early diagnosis, and prompt treatment are essential in preventing complications.